a non-surgical rhinoplasty is when we use fillers, and typically a filler type called hyaluronic acid, which is actually a sugar we have in our skin already, to reshape the nose. And most commonly, it's used for people who have a little bump on the bridge of their nose. And we actually use that filler to reshape their nose so that from the profile, the bump can often become invisible. And you can go from having a little bump on the bridge of your nose to either a profile that's really, really straight or even a subtle little curve. It also helps in patients who have a little bit of a droopy tip to their nose. We inject small amounts in the very tip of their nose, and it actually helps to kind of lift that tip, again improving their profile, but also giving a little bit more definition to the tip of their nose. So what's the difference between a surgical and a non-surgical rhinoplasty? Well, surgical rhinoplasty implies that there's a surgical procedure, and it's when we use surgical techniques called rhinoplasty to reshape the nose. And that nose might have a bump on the bridge, it might have a droopy tip, it might have a wide tip. Patients might feel that their nose is too long, patients might feel that their nose is too wide, and these surgical techniques or rhinoplasty are used to reshape the nose, basically tailored to whatever the patient wants. A non-surgical rhinoplasty is a non-invasive technique that again is also used to reshape the nose, but instead of using a surgery, we're using filler. And it's non-invasive because this filler is delivered through needles, injections, and we can use it most typically, let's say, to reshape somebody who has a little bump on their nose and maybe a droopy tip that lacks a bit of definition. And using a filler called hyaluronic acid, which is actually a sugar that we have in our skin, we can get great results in reshaping the nose, but not everybody's a candidate for the non-surgical, just like not everybody's a candidate for the surgical rhinoplasty. And it really takes a good consultation process to determine whether or not you're a better candidate for the non-surgical or the surgical. Some patients are candidates for both, but oftentimes patients are really going to benefit much more from either the surgical or the non-surgical procedure. So how long do the results of a non-surgical rhinoplasty last? Typically anywhere from about 6 months to a year, and it's variable from patient to patient. Some patients I see every 6 months for a top-up. Some patients will come back after a year, rarely a bit longer, but that's kind of in general the range of how long the results from a certain non-surgical rhinoplasty can last.